I'm Andrew Hordes. I'm a cardiologist at the Cardiology Center of the Appalachian Regional Healthcare System. Growing up, my dad, who was a school teacher, was what was called a science specialist. And he presented science to me growing up through magic tricks. And he was also an amateur magician. So he would do these magic tricks, and I became really enamored with science growing up from a very young age. And I had a very good aptitude for science and math, and that sort of led into saying, well, what can a person who's really good at science and math do? What area of medicine I chose, cardiac electrophysiology, really is just an extension of my interest in science, computers, and electronics, which was also a major influence growing up, always building all sorts of science experiments. My grandfather was an electrician, and so he taught me quite a bit, and all those things kind of tied together and worked out into something that I can do for a living. The most fun I have at work is implanting devices in the cath lab. And when I have a really challenging case, it's something that I think about ahead of time for several days in advance. And there's always a little bit of tension going into the lab, thinking about how this is going to come out in a very critically ill patient. When I'm not at work, I really enjoy diving into my music. I'm always writing one or two compositions at the same time. Piano is both an exercise for me, because I play it at a very rigorous level where my heart rate is definitely going up and I'm sweating, but it's also a change of focus, use of the other side of the brain. It creates a nice environment for doing other things. Sometimes I do that before I have to come in and do a difficult device implant, because it does give me a little bit extra flexibility, dexterity, prepares me. So when I have a case like that and it comes out really well, which thankfully is most of the time, it's a tremendous feeling. And then many times someone comes into the office who has had that particular procedure done, and I walk in the room and I can see the look on their face before even saying a word, and I know if they're doing better or not. And seeing that look of improvement on their face it's hard to describe. It's like telling someone who has a very serious illness that they're not going to suffer and they're also going to live longer. And that's a very gratifying thing. Appalachian Regional Healthcare System makes life better.